All listening. I present the Health Emergency Operating Committee Situation Report for Wednesday, September 29th. I begin by reminding us the COVID-19 virus is still in circulation in the Federation. Therefore, we are strongly recommending the adherence to the non-pharmaceutical COVID-19 protective measures and behaviors. These include wearing a face mask appropriately covering both nose and mouth, frequently sanitizing your hands with soap and water and an alcohol-based hand sanitizer, avoiding crowds and crowded environments, and maintaining a safe distance of 6 feet or more from persons with whom you interact. And if you or your child are feeling ill or have symptoms, please stay at home. You may contact your healthcare provider via phone for further instructions. These measures have been proven effective in reducing the impact of the pandemic. The Lambda variant of the virus continues to be circulated in the Federation. On Tuesday, 28th September, an additional 27 cases were confirmed, bringing the total number of cases to 1,918, with 333 in Nevis and 1,585 in St. Kitts. While 990 cases have fully recovered, we are monitoring 915 active cases, with 128 in Nevis and 787 in St. Kitts. There are currently 10 hospitalizations, 2 at the Alexandra Hospital in Nevis and 8 at the Jeanne France General Hospital here in St. Kitts. We have also recorded 13 COVID-19 related deaths. The following slide shows the vaccination status of the COVID-19 cases as of September 28th, with 51% of the cases not being vaccinated, 8% partially vaccinated, and 17% fully vaccinated. This indicates that the unvaccinated are most affected by this current wave. The next slide shows the cases affected by age group. Please note that this current wave is impacting persons 20 to 29 years and 30 to 39 years, our young adults, at a higher rate than the other age groups. However, the cases span the entire age range from childhood to over 60 years. As previously mentioned, we have 915 COVID-19 active cases. All confirmed cases are connected to a case manager who closely monitors their progress. It is important that each case stay connected with your case manager. If you experience any change in your condition or medical status, please reach out to your case manager immediately. Additionally, boost your immune system by eating healthy meals rich in foods that contain high levels of antioxidants, vitamins, and minerals like fruits and vegetables. Stay hydrated by drinking plain water, get enough rest, and exercise regularly. As part of the COVID-19 response, our contact tracing and testing program continues with both targeted and random testing. During the period May 19th to September 28th, approximately 33,493 samples have been processed in St. Kitts and Nevis. Now, as part of the contact tracing process, when an individual is confirmed a positive case, that person is placed in isolation and assigned a case manager. If fully vaccinated, the time to recovery may be 7 to 10 days, while an unvaccinated person may be ill for a longer period. To be deemed fully recovered, a case must receive 2 negative RT-PCR test results. Therefore, serial testing for cases is also a part of the process. Now, contacts of cases are automatically placed in quarantine. If unvaccinated, the quarantine period is 14 days. You will be tested at the start of the quarantine period and again at the end of the 14 days. Once both tests return negative, you will be officially released from quarantine. For persons who are fully vaccinated, an initial test will be done and you will be allowed to go about your regular daily activities. However, you will be monitored for 7 days. At the end of the 7 days, a second test will be done, and if both tests return negative, you will officially be released from monitoring. So how do we move forward? This involves continuing our contact tracing efforts, which are guided by robust protocols. Persons are being asked to cooperate fully with the contact tracing team when they call. Please be honest and provide full disclosure of all the persons with whom you would have been in contact. COVID-19 testing will continue with cases being placed in isolation, either in their homes or in a government facility, and contacts of cases being asked to self-quarantine. Clinical management of confirmed cases will continue as all cases are linked to a case manager, all of whom are senior nurses. We will also continue our COVID-19 vaccination program. Now, as of the end of day, Tuesday, September 28th, 75.8% of the target population have received their first dose of the vaccine, and 67.5% of the target population have received their second dose. Now, this is the target population of the adults. For the children, 7.6% of the target population have received their first dose, while 2% have received their second dose. On Wednesday, September 1st, we began the Pfizer-BioNTech vaccine rollout. I would like to remind you that the vaccine is safe and effective and accessible at all health centers by appointment only. We offer universal eligibility. Therefore, persons aged 12 years and above can receive the vaccine. The vaccine regimen is 2 doses given 21 days apart. Now, some of the common COVID-19 signs and symptoms that we have been seeing here in the Federation include headache, an altered sense of taste and smell, joint pains, dry cough, GI symptoms with bouts of watery stool and nausea, cough, body aches, and low-grade fever. I close by reminding us that living with COVID-19 requires adherence to the COVID-19 protective measures, and these include accepting the vaccine, wearing a face mask, proper hand hygiene, maintaining adequate distance from others, and please stay at home when ill or ordered to do so. Let us all work together to reduce the impact of this disease. Stay safe, stay healthy. Thank you.